It's now my pleasure to introduce our first guest speaker to talk about the issues that are related to LGBT domestic violence. Put your hands together for Jasna Magić from Galop. Thank you.
Oh, hang on. Right. I almost feel like a rock star with all the mics and everything and the crowd. Anyways, thank you so very much for having us here. It really, really is a pleasure. And before I start with my presentation, I just wanted to say a huge congratulations to organizers of this conference. I just can't emphasize enough how important it is to have this conversation, to have the space really to address these topics. We know at Galop actually how many professionals still struggle with this, with understanding around LGBT domestic abuse, but we also know equally how hard it is to talk to LGBT community and actually try and launch a conversation within the community and actually and kind of, I guess, increase the recognition of domestic abuse that it actually happens, as Catherine Donovan was saying, that this is one of the struggles today. And equally, I wanted to congratulate SAYiT on the setup of a new service. This is extremely, extremely important. Some of you might know that for the past 2 years. So just to say, Galop is based in London and most of our services are London-based. We are essentially a frontline service. However, for the past 2 years, we've been extremely lucky that the Home Office has funded a national, let's call it a second-tier attempt of a program. So it was a research and advocacy program called Recognize and Respond, which allowed us to build links outside of London, and it allowed us to actually gain an insight into what's happening around domestic abuse in Wales, in Northwest, in Southeast, and so on. And in the past 2 years, we've seen, sadly, many LGBT domestic abuse services closing or initiatives closing rather than actually opening. So to be here today actually at an opening of a service is not only exciting but also very motivating and very inspirational. And congratulations for that. And I do hope that we will, as we go along and as we build our partnership, we'll strengthen it and actually work together. Right, so I know I don't have loads of time. So what I want to talk to you about today is I wanted to introduce some of the key findings of our upcoming report, which is titled Recognize and Respond, Strengthening Advocacy for LGBT Survivors of Domestic Abuse. So I've already mentioned that we ran a project called Recognize and Respond, which literally just finished in June this year. It was a 2-year project, research and advocacy project. I do apologize, I can speak very fast. So if I go too fast, just throw something at me. So the report kind of brings together all the learning and all the knowledge that we built during those 2 years. So, hang on, there we go. So what were we trying to do with the report? We were trying to bring all the knowledge that we kind of collected and evidence that we collected to produce a tool to support services in their attempt to improve their understanding of LGBT people's experience of domestic abuse and consequently tailor their responses to appear more welcoming and more inclusive for LGBT survivors. So there was, I mentioned already, there was a 2-year research project. So there was numerous activities, there were several activities that were happening on a research level. So I'm kind of listing just a few primary sources of our data collection, which was an extensive literature review of UK-based literature, which either directly explored LGBT domestic abuse or included explicit references and figures around LGBT domestic abuse. We conducted a series of interviews and meetings with LGBT domestic abuse advocates and experts. For example, we coordinated or co-hosted 2 national meetings. One was for the purpose to support Home Office consultation on the domestic abuse bill in May 2018, where we brought together, I think, 7 different LGBT specialist services from Wales, from Birmingham, from Brighton, from Manchester, to feed into the consultation response. And then the second meeting, which also informed this report, was basically what we now provisionally refer to as an attempt to set up a national LGBT domestic abuse network, which actually still exists, and we're happy. We'll be happy to welcome SAYiT into it as soon as possible. So this meeting took place in October last year, and there was some really interesting discussions in these meetings in the outcomes of the meetings that actually inform the key findings of this report. In addition to that, we conducted 8 semi-structured interviews with professionals working in LGBT specialist services. We also draw on LGBT service user data sets So I should say that there were 7 partners that collaborated with us on the production of this report. And I already mentioned there are 7 specialist services based in Birmingham, Cardiff, Manchester, Brighton, and London. And these were also the services that provided us with their LGBT service user data sets. So the reason why we were curious to see that is because we wanted to understand we knew that LGBT people are not likely to access generic or mainstream services. But we wanted to actually understand better what is the profile of an LGBT survivor that accesses LGBT specialist service in order to understand where the gaps are, in order to understand which groups and subgroups still could benefit from more targeted promotion or even tailoring of our services. So this was the kind of the key aim of us looking into this element. And then we also draw on joint submission to government consultation on the proposed domestic abuse bill. So why we mention this specifically is because this document, which ended up being about 35 pages of a joint response by us and 7 services, actually served as a prompt for us to kind of understand that actually we do actually have a sector. It's a tiny, tiny sector consisting of 7 services, but actually we have a sector. We have a lot to say. We have built a lot of experience in the past 10 or more years around addressing domestic abuse. We've managed to develop innovative and creative approaches in addition and basically draw on existing achievements. And basically this is not written anywhere, it's not documented, it's not evaluated. And there's still, despite of all the expertise, there are still numerous gaps in policy. So when we were putting together the response to the consultation, there was a story in there. So we thought actually this story needs to be written, and this is how this report came about. Anyways, so this report, in addition to scoping and highlighting LGBT specialist services interventions, also basically talks about barriers in access to services, talks about the scope and nature of abuse, talks about tactics of abuse, and actually this is what I want to specifically focus on, if I can move my slide. So I decided, because of lack of time, I decided not to focus on national service provision, but basically we'll speak about nature and tactics of abuse, scope of LGBT domestic abuse, barriers in access to services, and key trends in accessing LGBT specialist support. I thought actually this, in the context of a new service, might be most relevant for today. But yes, I'm happy to answer any other questions around the national, around the services. I'm not going to dwell loads on stats because I know that Catherine actually already talked about that. We make 2 conclusions in our national report. One is that LGBT survivors experience similar or higher rates of domestic abuse to that reported by heterosexual cisgender women. So the difference to the data that we had in other reports is that when we speak about domestic abuse, we don't speak about intimate partner violence. We understand it as abuse perpetrated by family members as well as ex or current partners. So for now, we had 1 in 4 prevalence rate, which most related to intimate partner violence. We actually lifted that to domestic abuse. And what we say is that at the minimum prevalence rate. So if you ask me personally, I would say it's much, much higher. I would say it's 1 in 3, if not more. But we actually don't have national statistics that would give a full picture. We have some limited stats from Office of National Statistics. Crime Survey for England and Wales does not disaggregate data by sexual orientation and gender identity. Police, as we know, does not record, except in Manchester, does not record domestic abuse. So we have very little to draw on when it comes to national picture. So what we did is we pulled together findings from several studies. So these are just 5 studies, 5 national studies. There's more in the report. We pulled together all the studies that we could find based in the UK and looked at the percentages. And the lowest was 25%, and this was the only one that was so low. Everything else was much, much higher. So that's how we came about with 1 in 4 for domestic abuse, and that's what we're suggesting. We'll see, we might be challenged when we launch the report. We'll see, but anyways. In terms of nature and tactics of abuse, what the findings of our report suggest is that, so the question we were trying to answer is, how does LGBT domestic abuse look like? Because this is a question we often get from professionals. it looks like domestic abuse you're used to work with and you're used to address. It doesn't look any differently. We know that LGBT survivors experience domestic abuse from intimate partners as well as family members. And the nature and type of abuse does not differentiate. So it will be emotional abuse, it will be physical abuse, sexual violence. We have cases of FGM, we have cases of corrective rape and other forms of violence against women and girls, honor-based violence. So if you look at our report, which was published last year, you'll see we broke it down all by gender identity and sexual orientation to kind of showcase how that comes into play with our clients. But where differences actually do come into play, and Catherine talked about this today, is tactics of abuse. So there are specific tactics of abuse based on person's gender identity, sexual orientation, and I know you're all familiar with outing or threat of outing as a very specific, and in our at Galop, actually one of the most recorded tactics of abuse. I'm not going to go into tactics of abuse because, in terms of detail, because Catherine, you've covered that, and I'm sure other speakers as well. There's also, quite a lot of reports now, studies do go into details. We have fact sheets on a Galop website if you need a list, for example, for your service. I know that Birmingham LGBT in their Another Closet report also mention tactics of abuse. LGBT Foundation have fact sheets on their website, so they are widely available. But one tactic of abuse that we actually have come to kind of work with at Galop, and I actually don't see it documented quite a lot, but interestingly it's quite high in our service. Is we don't actually have a short version for it. It's basically, we call it spousal visa abuse. Does that ring any bells? Yeah. So when someone basically comes to the UK, marries, experiences abuse, and their abusive partner will use their lack of knowledge around immigration law or so to threaten them with deportation. So this might sound as sometimes professionals will say, but actually, maybe it's safer for them to go back home. No, it might not be, because in LGBT cases, we often might send people home to countries which have hostile legislation. We're actually coming back home and outing them as gay or lesbian or bisexual person might actually get them killed. And that is something that is actually missed in a lot of professionals' views, and we're trying to really raise the profile of this particular tactic of abuse. The last point around nature of tactic of abuse is so more and more studies, thankfully, are disaggregating data by LGBT subgroups. So if you compare the studies that were done in early 2005. They were kind of compounding LGBT as a one group, but luckily the last 5 or 6 or so years, we have studies breaking down experiences and showcasing actually that experiences are quite different and can be quite different for lesbian, gay, bi, and trans survivors. So in the report where the stat is from, actually we do a lot of comparison and cross-tabbing between cisgender and LGBT survivors, and then between LGB between LG and B survivors. So this is just one of the, sorry, it's not on here. Anyways, it's in the report. But basically what I'm trying to say is that, for example, just to kind of demonstrate, we see a lot of gay men disclosing sexual and physical violence as opposed to, for example, lesbian women disclosing disproportionate rates of financial violence and emotional abuse. This is not to say that lesbian women don't experience sexual or physical violence. It's just what the disclosure rates are different. But this also points to very different needs. So I guess it's really, it should, as professionals, we would recommend, I guess, to look into what the differences in nature of abuse are. Barriers and access to services. I know that Galop has been really loud in the last 2 years, or especially around when we were working on domestic abuse. We talked about barriers and access to services. I'm really going to be as short as I can on this topic today. So there's 3 conclusions we are suggesting in our report, and this is really a crude summary. So LGBT survivors face distinct systemic and personal barriers in accessing services due to their sexual orientation, gender identity. And one of the biggest barriers, again, I'm going to go to Catherine, is the public story of domestic abuse. And we see that more and more in our service. People will say, oh, I didn't realize actually this was domestic abuse. And actually, one of the contexts where we see that most is domestic abuse with young people. young people are extremely reluctant to label abuse coming from parents as domestic abuse. I mean, they're extremely reluctant to label it as abuse anyways, but in best of cases, it will be initially reported to our service as hate crime rather than domestic abuse, and also professionals tend to say it's hate crime rather than actual domestic abuse. So something just to keep in mind as you work with young survivors. LGBT domestic abuse is vastly underreported and underrecorded. So underreported obviously for different barriers. Underrecorded because services, we still see some services still don't ask for sexual orientation and gender identity in their monitoring forms, which is alarming, because if you don't ask that question, how do you know who you're working with? How do you know what the needs of this particular group is? And I'm going to tell you an anecdote actually, because you might think, oh, why is this relevant for an LGBT service? It's relevant because I worked closely with a service last year who assumed that everyone who's coming to them is LGBT, and they actually did not ask for sexual orientation and gender identity in their monitoring forms. And when we wanted to ask them for service user data sets, they said, oh, we never monitor for that. And I was like, well, how do you mean? How do I know who's who in your service then? Oh, well, we just never thought of that. So it is important. I mean, it can also happen to us. You know, we are as guilty as anything. But just to keep in mind, it is extremely important to know who you're working with, what the needs are, and when this comes into play. LGBT specialist service provision is patchy and inconsistent. So coming back to the speech I made before I started my presentation, really 7 services in England and Wales, actually, well, 7 now with SAYiT. It was 6 until yesterday. 7, that's depressing. I'm really sorry to say so. It's really depressing because everywhere else, I mean, what do you do? For example, we're on a national domestic abuse helpline, and we often will have callers from very different regions where there is no local LGBT support and where services might not actually be aware of LGBT domestic abuse. So what do you do? Where do you refer that client? They can't come to London. They can't come to Sheffield because they're based in I don't know where. And it is often a struggle for services to try and I guess, well, for our service really, to try and accommodate all the needs, especially in regions where we don't have that support. So one of the recommendations that we're making towards the Home Office, and especially in the framework of the Domestic Abuse Bill, is that there is a desperate need to increase funding, to increase sustainability of services, and to increase and expand the current service provision. So looking at the new service here, sustainability and continuity is absolutely key for our work. So coming to the last point that I wanted to, point that I wanted to talk about is key trends in accessing LGBT specialist support. So in comparison to previous findings, which were mostly, where we mostly draw on literature review, the key trends were basically based on the LGBT service user data sets that I mentioned earlier. And obviously, because we were only working with 7 service user data sets, which is a really, really low number, we also basically included in our review, we included some of the more relevant findings from the literature review, where that was possible, of course, to strengthen our conclusions and trying to assess the key trends in accessing LGBT specialist support. So these are LGBT survivors accessing specialist services across England and Wales. So we broke down the analysis by protected characteristics, age, gender identity, ethnicity, and disability. So that's what I'm going to use as well as framework for kind of briefly go through the main conclusions. So in terms of age, not surprising, across all services, we've noticed a trend that under 24 and those over 65 are not accessing support with the same rate as other age groups. This is not surprising, but it does indicate that actually these 2 age groups do require extra efforts from all services, specialist services, made in trying to increase the numbers of people coming into our service. Another thing that was very interesting as well is that under 24 were more likely to use remote services such as phone and helpline. So for example, when I compared the data set from our national LGBT helpline to other data sets, which were all one-to-one or caseworker-based data sets, this one stood out in a sense that it had the highest proportion of young people calling in. All the other data sets the average was between 35 and 44 age group, whereas the helpline had 24. I think there was 65% of callers were under 24, which I thought was quite interesting. And again, not surprising, over 65 are more likely to experience barriers associated with health status. So where we had data around people over 65, the question around disabilities, the question around additional risks did show actually that there was almost 90% of those that we had recorded, but again, the numbers were really low, disclosed additional risk and vulnerabilities in comparison to other age groups. Going on to gender survivors and perpetrators. In most cases, services supported high numbers of male clients over other genders. For example, in our casework service, so we did a quick analysis of the last 5 years, we had our casework service based in London, so one-to-one service, supported 700 survivors, and 65% of those were male. And actually, when I looked at other services in Manchester, Birmingham, Brighton, actually this was the case everywhere else, which was really, really surprising. Because I kind of thought, okay, London, fine, it's going to be a different figure. Not. And actually, there's different theories why this happens. It could be related to the nature of disclosed, abuse, but also we know that domestic abuse and mainstream services are mostly targeting women and girls. So that might actually, even where they support men, this support is not widely advertised. So male survivors might actually think that this support is not targeting them, it's not inclusive, so that's why they'll access specialist services. Female survivors are more likely than male clients to use remote services, such as phone helpline. Again, as previously with age, our helpline kind of showed, I think it was 60% of callers were female, whereas all the other services showcased higher percentage of male survivors. Again, possibly due to different nature of disclosed abuse, due to different needs. This is, I guess there's theories to be set around that. LGBT, so the third is actually really interesting because it shows that even in LGBT communities, domestic abuse is a gendered issue. So LGBT survivors of all genders largely disclose abuse from male perpetrators. This applied across all sexual orientations and across all gender identities and genders. So again, referring to Galop, because I know this, I always say Galop, but I know it by heart now. So 95% of our male survivors experienced disclosed abuse by male perpetrators. 80% of female survivors disclosed abuse by a female perpetrator, but still 20% was male perpetrators. So that was something that I guess is not surprising but interesting. Going on to trans identity, this was actually quite an interesting one. So we were looking at the access rate across, and this was a very hard one to kind of find a common trait because the numbers were very, very different. And outside of London, they were quite low. But in London, they were between 10 to 14% for services. It's not surprising though, because we know that trans communities are biggest in London, so that's not a surprise. But actually, what surprised me though, because kind of having been in the research field for quite some time now, the usual percentage of trans respondents across different services is about 6%, even lower. And to actually find 10 to 14% trans clients access services is actually spectacular. I mean, it still seems low, but actually in what we have so far. And looking at, I don't know if you're familiar with Safe Lives Insights dataset. So they very recently started including the indicator on gender identity. And I think for the year 2016, they recorded, so this is a national insights, so recording over 900 domestic abuse services, it was less than 1%. So I think it's actually, I'm gonna just say it actually, I think it's worth saying that trans survivors are considerably more likely to access specialist services for obvious reasons than mainstream services. They're also more likely to disclose abuse by family members than any other group compared to LGBT and cisgender survivors. And this is the only subgroup where we found that gaps in policy actually allow services to exclude from service provision. I don't know if you're familiar, I don't want to go into the debate around trans survivors and supporting trans survivors, but basically there is a clause in the current equality law that allows services in exceptional circumstances. It doesn't conveniently explain what those exceptional circumstances are, but it does allow services to exclude on the basis of gender identity. Luckily, there are very few services that we know of that have done that, but the fact that they can is actually very, very alarming. So hopefully none of you here do that. Additional risks of disability, additional risks and vulnerabilities, pulling together the data sets and also the research that we knew of, at the minimum, and this is really at the minimum, 1 in 3 LGBT survivors disclosed one form of disability. For Galop, this was over 55%. And this actually confirms the findings from Safe Lives. So these last 2 findings are from Safe Lives report published in September last year, where they basically say that by the time they access services, so this is from Insights, LGBT survivors are more likely than their non-LGBT peers to present with complex and additional needs such as mental health issues, issues related to alcohol and drugs misuse, mobility, or long-term health problems such as living with HIV and AIDS. And in comparison to non-LGBT peers, LGBT survivors are twice as likely to have self-harmed, are more likely to be abused by multiple perpetrators, and disclose experiences of historical abuse by a family member. So this is something that Safe Lives claim to be of statistical importance. It's quite a low number of clients that they're working with, but actually it's Safe Lives, so I do trust them. So this is really, really interesting. So what does this tell us? This tells us that when we work with LGBT survivors, we have to be prepared for a perfect storm, so to speak. We have to be prepared for loads of different things that these clients are going to bring on board from past experiences of abuse and hate crime that might actually shape our responses to understanding of abuse first, and then our responses to abuse, and specifically domestic abuse, and then everything else that comes into play around domestic abuse and our understanding of that. So yeah, it's challenging setting. So finally, the last thing around race and ethnicity. So services engage with BME clients at a very varied range, again, ranging from 25% to 49%. This was actually, for me personally, really surprising finding, because I expected this to be much lower. So we knew at Galop, for example, that we had a high proportion of BME clients, but we never knew the actual rate until we did an analysis, and it was actually 49%. And I thought it was extremely high. We didn't really understand why this was so. But this is actually a really exceptional and really positive finding, because all the studies that I've reviewed for this report suggest that LGBT BME clients are highly unlikely to engage with any services. So to actually study 7 LGBT data sets and actually find these high numbers is actually really encouraging. So we must be doing at least something right. And as trans survivors, BME people, in comparison to people with to survivors with white background, were at disproportionate risk of abuse from family members in comparison to clients with clients with white background. And in terms of barriers, there are additional barriers to this group on the level of language. They might identify more strongly with a BME identity than LGBT status. And they might have to overcome religious and cultural pressures when making a decision to access help and support. So on the basis of some of these findings, I pulled together 6 recommendations from the report. These are not all the recommendations, just some of them, just on the basis of what I talked about today. And I know you know all that, but just to kind of reaffirm, ask about sexuality and gender identity. Do not forget, it's really important, even if you're an LGBT service. Build knowledge and capacity to meet the needs of diverse LGBT victims and survivors. Again, going back to the point, we're not homogenous, we're not all the same, our experiences are not the same. Apply a nuanced approach and develop person-centered support, recognizing the different and intersectional needs of survivors. Going back to the point around LGBT people will go through different structural and personal abuses in their life, which will shape our understanding of abuse and domestic abuse specifically, and will shape our response to abuse. Recognize additional barriers in access to services and increase welcome for young and elderly LGBT survivors and trans survivors. I didn't really go into barriers today, but it's really important, I guess, to understand that barriers exist on the level of how services are designed and delivered that might make them less welcoming. So, for example, often, when we publish annual reports, do we feature LGBT cases in? Do we put LGBT visual material in? Do we put case studies in? And services will say, but we only had a few clients with LGBT background. So what? Put that story in. They were still your clients. They're not less important, even if you had 3 or 4 cases. And actually, if you put a case study in, you might actually get 10 cases next year because you've opened those doors. So very, very important. Visibility and representation is extremely, extremely important. On the both internal and external materials. One thing I want to say about visibility and representation as well, which we don't actually think about or talk about enough, is visibility and representation doesn't only matter on the level of printed materials or policies and statements, but also how we address LGBT issues as a collective, within the culture of our organization? Do we talk about how domestic abuse bill affects LGBT survivors during a coffee break? Do we have LGBT? Do we have people with openly LGBT background in our staff, talking about mainstream and generic services? Do we allow those people to actually talk freely about who they are, what they do, their knowledge? Do they have opportunities to share their knowledge? Very, very important. And I think this was said quite a lot today: establish close links with relevant and local services, be able to signpost and make informed referrals. So I really appreciated actually the question earlier around how do we unpack who's the perpetrator and who's the victim. This is an extremely important question. And actually, our caseworkers, they'll, pardon for me being blunt, they're banging their heads against the wall often in trying to unpack who's who. Having close links with agencies and consult, call up a service, call up a partner service, ask questions. There might actually be, and it might not be known to you, there might actually be a record of those people accessing service, and you'll see who made the report, where and how, and you'll be able to put a story together easier and unpack those clues. And Respect, do you know Respect, the perpetrator service? Mm-hmm. They've published couple of years ago a tool on how to work with perpetrators, and there is a schedule of questions how to unpack who's a perpetrator and but Catherine already gave you a really, really good advice, but just if you wanted to kind of recheck that. And again, finally, and that's it for me, consider facilitating mutual support and other opportunities such as reciprocal training and awareness raising. For my work in particular, as someone who works nationally, partnership building, engaging with services, going around the country is extremely important. I really, really welcome partnerships. And they've really informed our work as Galop as well. So if you have that, if you can have that in your local environment, this is extremely important because it won't only inform your work, you will actually be able to have access to an area which might actually really benefit from your knowledge and your expertise. Right, okay, so this is for me. Thank you very much. Yeah.